Welcome back to Docshala. So today our topic of discussion will be AAE Glossary of Endodontic Terms. So what is AAE is that? It's nothing but American Association of Endodontists. Okay, so let us just dive into the topic now. So this is a question from Dental Dex. So the question is like this. Which of the following is a clinical diagnosis based on subjective and objective findings indicating that the vital inflamed pulp is incapable of healing and has the following additional descriptors, that is lingering thermal pain, spontaneous pain and referred pain. Okay, so the question what it is asking is, there is a clinical diagnostic tooth, okay, so which is subjective of vital inflamed pulp. So the pulp here is inflamed, okay, and is incapable of healing. Pulp is not able to heal properly, and it has the additional descriptors. So these descriptors are being said by the patient. It has lingering thermal pain, spontaneous pain and referred pain. Okay, these may be said by the patient or maybe diagnosed by the clinician himself. Okay, so this is how the tooth is. So when the tooth is like this, what diagnosis will you arrive from these findings that you have found? Okay, so the options are reversible pulpitis, asymptomatic irreversible pulpitis, symptomatic irreversible pulpitis, or is it none of the above? So let us just see how AAE is defining some of the terms which we normally use for diagnosis of a tooth, especially in endodontics. Okay, so the normal pulp. So the normal pulp is defined as a clinical diagnostic category in which the pulp is symptom free and is normally responsive to the pulp testing. So according to AAE, a normal pulp is the one where the pulp is symptom free and normally responsive to pulp testing. Next, reversible pulpitis. So it defines reversible pulpitis as a clinical diagnosis based on subjective and objective findings. So subjective and objective, we are using these two terms very often in this thing. What is subjective? What is objective? So we know what is subjective and objective, right? One is said by the patient, one is found by the clinician. Okay, one is symptom. The other thing is the diagnosis, the signs that the clinician observes. Okay, so indicating that the inflammation should resolve and pulp should return to normal state. So in this case, we can find that the caries is involving only a minimal portion of the tooth, but it is also involving the pulp. But in this case, we can take it back into the normal stage by simple restorative procedures. Okay, then symptomatic irreversible pulpitis. So a symptomatic irreversible pulpitis is a clinical diagnosis based upon subjective and objective findings indicating that the inflamed pulp is incapable of healing. So incapable of healing, the pulp will not be able to heal properly even after the treatment. Like we cannot get the normal tissue pulp back. Okay, so additionally it also involves lingering thermal pain, spontaneous pain and referred pain. Okay, then asymptomatic irreversible pulpitis. So it is a clinical diagnosis based upon subjective and objective findings indicating that the vital inflamed pulp is incapable of healing. Yes, irreversible pulpitis is where the pulp is incapable of healing, right? So here what is the difference between symptomatic and not asymptomatic is that in asymptomatic we know that we cannot see the symptoms. Okay, no clinical symptoms are seen, but inflammation may be produced. We can see the inflammation at least, like from caries or from caries excavation or from trauma. Some sign, some simple sign we can just see. Okay, then pulpal necrosis. So what is a pulpal necrosis according to AAE? It is a clinical diagnostic category indicating death of the pulp. So the pulp is completely dead here. Okay, and pulp is unresponsive to pulp testing. So pulp doesn't even respond to pulp testing. Even on putting on higher grades, the pulp is not responsive. Okay, so completely the pulp is dead here. Then previously treated. So previously treated is a clinical diagnostic category indicating that the tooth has been endodontically treated, and the canals are obturated with various filling materials. So various filling materials are used other than intracanal medicaments. So intracanal medicaments like Calplus or any other thing is not used, but the tooth has been endodontically treated previously. So this is a picture depicting the endodontic treatment of the abscess here. Okay, so tooth is treated, but we are not using any intracanal medicaments in there. We are just filling it with some other filling materials apart from the intracanal medicaments. Okay. Then previously initiated therapy. Previously initiated therapy is a clinical diagnostic category indicating that the tooth has been endodontically treated by partial endodontic therapy. That is, we have started the therapy. Okay, we have started the therapy. Either it may be pulpotomy or pulpectomy. We have started it, but we have not finished it. Okay, when it is not finished, then we say that it is previously initiated therapy tooth. Okay, we can just appreciate here like what is pulpotomy and pulpectomy. We know, right? Pulpotomy is nothing but we remove the pulp in the coronal portion and replace it with a medicated filling. But this root portion is alive, right? Okay, and pulpectomy is we remove the pulpal portion from crown and from root, everything, and we replace it with a filling. So these procedures, when they are started but they are not completed, then it is termed as a previously initiated therapy. So let us just come back to the question, right? So in the question you have seen that which of the following clinical diagnosis is based on subjective and objective findings indicating that the vital inflamed pulp is incapable of healing. So when the pulp is incapable of healing, is it reversible pulpitis? No. Asymptomatic irreversible pulpitis, symptomatic irreversible. Of course, when a pulp is incapable of healing, it is irreversible pulpitis. Right, so we have two options telling whether it is symptomatic or asymptomatic, so that we can solve it based on the additional descriptors that they have provided. Is it the additional descriptors they have provided are the lingering thermal pain, spontaneous pain, or referred pain. So all these three can be seen in yes, symptomatic irreversible pulpitis. Okay, so the answer is symptomatic irreversible pulpitis. In asymptomatics, there are no symptoms. Okay, no symptoms, and the pulp is incapable of healing. That is asymptomatic. Symptomatics, these symptoms are seen and the pulp is incapable of healing. Okay, I hope you have understood what it is, and you can just take screenshots or notes from this video so that it will be easy for you to revise while you're preparing for your exam. Okay, if you like our video, do subscribe to our YouTube channel. You can also follow us on Instagram at Dogshala for dental content, at Dogshala Medical for medical content. You can also find us on Telegram. Thank you.